Very good morning. So today's our topic is about drug-induced liver injury, so-called DILI or hepatotoxicity. So what are the physiological functions of liver? As you know, it helps in formation and secretion of bile, nutrient, vitamin metabolism. That means it will metabolize all the things what we consume, including lipid, protein and carbohydrates. So amino acids, lipid and glucose all are being metabolized through liver only. Detoxification and inactivation of various substances. Whatever is presented to the body in the blood, in GI, it is absorbed through blood and taken to the liver. So whatever we consume, whether it is a drug or some chemical, a colorant, a taste maker, whatever pesticide we eat along with our food, all will be presented to the liver. So detoxification and inactivation of various substances, it is a function of liver. Synthesis of plasma protein. Very less realized that liver is one of the major organ to produce plasma protein. Yes. Today you are early. Please come. So synthesis of plasma proteins like albumin and clotting factors. In fact, whenever we visit our ICU patients and we find patient is in sepsis, first indication will be lowering of the plasma albumin. Total level protein may not be decreased or it is within normal range, but first thing we see the affection of the total amount of albumin. So AG ratio in most cases it is reversed, and definitely whenever you see an ICU patient, you see swelling of feet or face, first thing think about that albumin may be low in these patients. So immune system, so by the Kupffer cells, the liver help in immune system. So what is hepatotoxicity? By definition, it refers to liver damage. So certain medicinal agents, whenever taken in overdoses or even in sometimes normal doses, prescribed doses, even then they may injure the organ. Why? So this is, we'll see now. So other chemical agents such as those used in laboratories and industries, natural chemicals, microcystins and herbal remedies. So many people just will confidently say, "Sir, मैं तो देसी दवाई खा रहा हूँ बाबा रामदेव की, and it cannot harm my body because they are herbal." It is their faith in the Ayurveda. In चाहे वो दवाई असर कर रही हो नहीं कर रही हो, they will think कि साहब ये कम से कम मेरे बॉडी को डैमेज नहीं कर सकती. So that is their deep faith in the Ayurveda side. But they are ignorant that these people may sometimes put some more metals or other chemicals that may in fact harm body as a whole and mostly liver. So whenever you take history of drug-induced hepatitis as a causes, look to the drugs which are allopathic one, but also drugs which are taken over the counter without prescription, and the drugs which are suggested by their friends and relatives in form of herbal medicines. So they may injure the liver. So chemicals that cause, whether it is medicine or not medicinal, that cause liver injury are called hepatotoxins. So drug-induced liver injury, it may be produced by large variety of chemical substances. The degree and type of injury produced is extremely variable, and that may mimic the entire spectrum of hepatobiliary disorders. That means you may not differentiate clearly that this is due to disease, some virus, some autoimmune disease, or it is due to drug induced. So even the signs, symptoms, and sometimes even the histopathology will be similar to all other hepatic diseases. The central role played by the liver, as I told you just now, played by the liver in the clearance and biotransformation of the chemicals. They all lead it to susceptible to the drug-induced injury. That means liver is handling all the products, chemical, which are presented from outside, whether it is drug or some other chemical, any flavoring agent, taste maker agent, all may be hepatotoxic. These drugs can initiate progressive chronic liver disease and are the single leading cause of acute liver failure. So most of the acute liver failure cases we encounter in our practice, it is said that about 90% of patients are due to some drug-induced liver toxicity. Chronic liver failure, of course, may be some autoimmune disorders, hepatitis A, B, C, that means viral infections or other infections and autoimmune disorders. But acute liver injury, acute liver failure rather, I must say, if acute liver failure suspect a drug-induced injury. So classification of the drug-induced liver injury. So it may be intrinsic hepatotoxicity or idiosyncratic. So among idiosyncratic, it is allergic or non-allergic. So what are intrinsic hepatotoxicity? It is regarded as a dose dependent and predictable above an approximate threshold dose. So any drug we give, what our books give, that is safer range. So safer range, these drugs if given probably will not produce any injury. So they are dose dependent. If we exceed the dose, we are exposing the patient to higher chances of drug-induced liver injury. So these are dose dependent. When dose is exceeded, then it may cause liver injury. Such are kind of chemicals or medicines called are intrinsic hepatotoxic drugs. Whereas in the idiosyncratic hepatotoxicity occurs without obvious dose dependence. That means dose may be prescribed there. It is within normal range. Still patient will suffer acute liver injury. Then it is called idiosyncratic hepatotoxic drug. So it is without obvious dose dependency and in an unpredictable fashion. So with a single dose, single tablet given in therapeutic dose, sub-sensitive persons may exhibit hepatotoxic symptoms. So these cases are called idiosyncratic hepatotoxic patients. So allergic one and non-allergic one. Allergic one, apart from the common symptom, they may show fever, skin rashes, eosinophilia, formation of autoantibodies, and short latency time, particularly after the re-exposure. So suppose a patient has developed some idiosyncratic reaction with some particular drug, and we ignorantly sometimes again prescribe, our patient takes again without proper prescription, because drugs come in different trade name. So patient go to the medical store, ask him, give me medicine for this ailment, for this symptom. He may give the commonest one, and he has already idiosyncratic reaction with that. So previous time it happened after 1 week, 3 days, 5 days, 7 days. But now with single dose he may develop idiosyncratic reaction. So there are multiple risk factors of liver injury. So environmental risk factors, genetic risk factors, and pharmacokinetics of the drug itself. So a person may consume a drug which is having different salt, different base rather I must say, जैसे erythromycin stearate or erythromycin acetolate. Both will cause different type of injury. So base may be different. So like TF, tenofovir, alafenate, and another salt, they both have got different base one. So they may react differently to a person in terms of hepatotoxicity. So different kind of enzyme deficiency may be there in a person. So normal person may tolerate it, another person may not tolerate that same amount drug, same drug in the same family. So genetic variation is also there. So it may cause initial liver injury, and in the presence of cytokine and TNF alpha, it may progress to severe forms. So progression of liver injury is seen. It may go into acute liver failure or chronic liver failure. So it's not that simply that we are giving some drug and all will produce the same kind of hepatotoxicity on histopathology. So on histopathology there may be different form of injury. So commonest one we are describing just to show you the zonal necrosis, some particular zone of the liver has been involved, say periportal zone, like that one. Hepatitis, generalized inflammation of the liver cells. Cholestasis, when biliary canaliculi are being affected due to drug toxicity. So they may give cholestasis. Steatosis means fat infiltration. So it is a condition characterized by build-up of fat cell within the liver, sometimes triggering the inflammation of the liver. So steatosis, again inflammation induced by the liver. So this one, fat inside the liver cells. Other types of injury may be granuloma production. Some of the drugs may cause granuloma production, and it will be informed in localized nodular inflammation in the tissue. Sometimes vascular injury. So vascular endothelium is involved in these patients. Sometimes neoplasm, aflatoxins, inadvertently taken or mistakenly or accidentally consumed with the food. So they may induce neoplasm. So all kind of injury we may find. So in general, drugs usually they will cause sulfation and glucuronidation. They will be metabolized by two pathways. So it makes few of the drug metabolites either will go for covalent binding and oxidative stress. So it may cause massive mitochondrial injury or intracellular stress, sometimes sensitization to TNF alpha, sometimes heptane formation and drug immune response is there. So initial direct mechanism is direct cell stress or direct mitochondrial impairment. So either cell or mitochondria in self specifically they may be affected. Direct or death receptor mediated pathways, and it will lead to apoptosis and necrosis. Apoptosis is self-destruction of the cell. A organ will destruct own cells. They will send a signal to its own tissue to die. So this is same thing, direct cell stress, direct mitochondrial inhibition or specific immune reaction. This is all the mechanism of drug-induced liver injury. So signs and symptoms are general. You cannot differentiate it, that it may be only drug-induced, only by clinical history, strong suspicion. So signs and symptoms, so jaundice may be there, loss of appetite, nausea, vomiting, fatigue, weight loss, dark color urine. So how we'll evaluate these patients? So we'll plan for LFT and evaluation of drugs. We'll see all the drugs one by one, evaluate whether it can cause hepatotoxicity, is it the cause? So drug which has been recently added, you should be very much alert that this was the last drug after which the patient has developed symptom. Our patient itself may say, सर ये मैंने दवाई आपने पिछली बार चेंज करी थी, ये दवाई सूट नहीं कर रही है, and it is causing me nausea and vomiting out. And then you find there is some jaundice also, and then you order drug test, lab test, and it will show you the rise of SGOT-PT and bilirubin levels. So after careful history taking, rule out other etiologies and evaluate the type of injury, and you may read to some conclusion. Yes, drug-induced liver injury is unlikely in this patient. It is only by chance association, or you may suspect it. Yes, drug-induced injury is common with this drug, say anti-tubercular drugs. So out of EHRZ, only E is safer for liver. HRZ, that means Isonex, rifampicin and pyrazinamide. These are all hepatotoxic. So you have to keep attention to the patient's drug history and whether he has taken any other drug from the counter or any other herbal medicine consumption. Sometimes काढ़ा बना के पी लिया, किसी भी ब्रांड का आयुर्वेदिक प्रिपरेशन ले आए, किसी पड़ोसन ने कह दिया आपने पी लिया. These are all make you have to rule out these things. So diagnosis of drug-induced liver injury, it may be either hepatocellular type, that is only SGOT-PT is raised. Sometimes it is cholestatic type, that means only bilirubin is raised only, that is most of the time it is conjugated bilirubin. So stasis is there. Sometimes mixed picture is there. So after careful monitoring, you have to discontinue the suspected drug. So what are the suspected point here? If ALT, that means SGPT, is raised more than 8 times or it is more than 5 times for 2 weeks or SGPT was only 3 times but total bilirubin is more than double. So symptoms and PTINR, if it is raised more than twice the range, 1.5 है तो कम से कम 1.5 गुना हो जाए, that means 2.1, then you may suspect that there is something wrong with the patient's hepatobiliary system. So what are the tests? You can just go through this, all that kind of tests you have to order. If patient is sick, we have to admit the patient and order for all these CBC, ASR, SGOT-PT, GGT, alkaline phosphatase, serum bilirubin, direct and indirect, prothrombin time, albumin level, total protein level, and suspected ANA test, anti-nuclear antibody test, or anti-mitochondrial antibody test. Viral we have to rule out, so hepatitis A, B, C, E. D is only by liver biopsy. So all these we have to rule out. So in concisely we say liver injury we have to do, see whether there is biliary abnormality, say there is cholestasis there. We have to rule out organic cause apart from the drug injury, because drug injury is only clinically basis we are seeing. So we have to go for ultrasound, CT scan or MRI or ERCP. If there is autoimmune features, we have to go for all the antibody panel. If metabolic, we have to go for the ferritin level, iron, TIBC, ceruloplasmin. So Wilson's disease like thing, we have to rule out that. Alpha-1 antitrypsin levels. If we suspect viral injury, then hepatitis A, B, C, E. Alcohol history we have to take. Sometimes people may have alcohol consumption and it may be, for them it is normal limit, but usually there is no limit in the alcohol drinking. So they are consuming alcohol on excess part and they get damage their liver. In the end they come with the frank ascites and cirrhosis of liver. If patient is having hypotension, giving history of hypotension or shock in the ICU or heart failure or vascular occlusion, We have to rule out these conditions, and then if all are negative, then it is possibly drug-related hepatotoxicity. So what are the clinical key guidelines? Do not ignore the symptom. Whenever we suspect a patient, we have to go for all the tests, possible causes of hepatitis. Take a careful history of drugs and how the symptom proceeded. Remove the causative agent. If you suspect and without confirming, we have to stop that drug. Jaundice after ATT, very common. We have to stop all the drugs. You have to give safer ATT drugs in place of that. Pay attention to Hy's law. So jaundice that appears after drug-induced hepatocellular liver injury suggests a serious and potentially fatal liver problem. So if there is possible hepatotoxic drug given to a patient and he develops jaundice, that means, and if develop SGOT-PT raised, okay, no problem. But if jaundice develop, that means bilirubin is getting high, then possibly he is having some fatal liver injury. It is a range may be 10 to 50%. So fatal in 10 to 50% is very great number. So if there is jaundice in these patients, immediately stop the drug, admit the patient for observation and further evaluation. Report the injury. Drugs and its mechanism to induce liver injury. So all the drugs, there may be different drugs causing hepatocellular injury, cholestatic type injury, immunoallergic, granulomatous, microvesicular, steatohepatitis, autoimmune fibrosis, vascular collapse, I said tumor genesis or oncogenesis, mixed type injury there may be there, and different drugs are there which may cause these type of injury. So all common type of medications which we use in our clinical practice in medicine, patient, all may cause hepatotoxicity. We have to give attention to each and every drug he is consuming. So drugs which causes liver damage, among the commonest one is acetaminophen, that is paracetamol. Very less realized, but this paracetamol, particularly in alcoholic hepatitis patient who is consuming moderate amount of alcohol, it may work differently. Already is glutathione depleted, so they may not metabolize even the normal quantity of paracetamol. So never prescribe paracetamol in higher doses to such patients. Only half tablet 2 times or 3 times a day are only SOS you have to prescribe in these patients, particularly in alcoholic hepatitis patient. Other drugs are non-steroidal NSAIDs, that aspirin, phenylbutazone not used nowadays, ibuprofen, piroxicam, diclofenac, indomethacin, glucocorticoids. So glucocorticoid, that is, they are no so named because they are effect on the carbohydrate metabolism, and they promote the glycogen storage in the liver. So glucocorticoids, they also may cause liver injury. INH, as I told you, is most notorious drug for causing drug-induced hepatitis. So cheaper drug, but very toxic in susceptible people. So natural products like mushrooms. So poisonous mushroom, it is said only single piece of poisonous mushroom is enough to kill a person, insensitive person, or if it is toxic one containing amanita mushroom. So aflatoxins, industrial toxins, so much talked about, carbon tetrachloride and vinyl chloride, herbal alternative medicines. So carbon tetrachloride, this is industrial toxin, and mostly you will read in your toxicology classes or toxicology chapters. So again the same type of symptoms may be there, and management is on expected lines. We will discuss about the parastomal poisoning. This is widely used drug found in many over-the-counter drug and prescription analgesic medicines. So it's common content. So combiflam we were prescribing previously, containing brufen plus paracetamol. Sumo tablet, nice plus paracetamol. Zerodol, aceclofenac plus paracetamol. Like that, every NSAID drug is containing paracetamol. So, in susceptible people, particularly alcoholic people, they may cause dangerous reaction. So, in adults, in normal person, if he consume 7.5 to 10 gram, then it may prove hepatotoxic. So again, it is metabolized by liver by conjugation to non-toxic components, and then glutathione comes into role, but it is able only to metabolize a limited quantity of paracetamol. After that, glutathione is reduced or it is consumed already. Then if heavy dose of paracetamol there, then it will go into produce a toxic metabolite, that is N-acetyl P-benzoquinone. So this is very dangerous. So if glutathione is not there in liver due to some reasons, or already it has been consumed by previous drug metabolism, then it will go into severe hepatotoxicity because of it is converted to N-acetyl P-benzoquinone. So this may cause cell necrosis. Signs and symptoms, as you expect in any hepatitis patient, there will be anorexia, nausea, vomiting, and altered mental status. So, particularly drug-induced liver injury, if serious, patient will come to emergency with a altered sensorium. So, increased transaminase, SGODPT levels, hepatic failure, and renal failure, anything may come. So, management, if patient is come early, we can give ipecac syrup, that is to induce vomiting, activated charcoal to bind it, the excess amount of any toxic, particularly paracetamol. N-acetylcysteine is the definite treatment for paracetamol poisoning. So, it is said 150 milligram of paracetamol is more than that per kg. Dose is toxic to the human body, and the same is the dose of N-acetylcysteine. So, 150 milligram per kg is the dose in 200 ml or in the 5% dextrose infused over 15 minutes to 60 minutes, and sometimes methionine we may use. Similarly with the ethanol, we all know all types of preparation of alcohol is being sold out in the market. They all may cause liver injury depending upon the amount of alcohol, not the type of the alcohol. We are all talking about the things which are being sold by the government shops. If we consume from outside, they may contain methanol. So, कच्ची शराब जिसको बोलते हैं, that has not been detoxified properly, then it is methyl alcohol. So, it may cause another type of injury. So, ethanol is found in a variety of perfumes also, mouthwashes, many food flavoring. Previously, so many appetizers and cough syrups were containing alcohol. Nowadays, it has been reduced or almost marketed out. So, these Ayurvedic products in name of appetizer, they were being sold with 80% of alcohol, and quite damn cheap as compared to the what alcohol is available in the government liquor shops, government allowed liquor shops. So people were consuming those Ayurvedic bottles, particularly rickshaw pullers, rickshaw चलाने वाले, साइकिल ठेला चलाने वाले, they were buying from the medical store, cheaper one. पूरी बोतल खत्म करी, शाम को घर चले गए. So like that, we have to take history. Anything you are taking appetizer even, then probably he is consuming alcohol. So it is most frequently ingested for recreation purpose, that means enjoy करने के लिए, and most common co-ingested when with other drugs. So person want to commit suicide, he may take a lump full of any medicine and he may consume alcohol also, so that he can sleep well before death. So mechanism of toxicity, again it is oxidized in the liver by ethanol inducible cytochrome 450 enzyme that converted to contain toxic radicals. Induction also results in energy wastage and increased production of acetaldehyde. This acetaldehyde is result in injury to the cells and mitochondria with a striking impairment of the oxygen utilization, not only liver but other body, particularly methanol. So great amount of acetaldehyde is produced and it will cause attack on retinal cells, blindness, optic nerve may be damaged severely. Patient will complain. Those who do not die may turn blind. So this is common history of all spurious alcohol being sold in the market. So it causes glutathione depletion and liver peroxidation and stimulate the hepatic collagen synthesis, thereby promoting the fibrosis and cell damage. So again signs symptoms be same. Alcohol ke euphoria, sense of well-being. You are on seventh sky. So people consume because of euphoria. Impairment of balance and muscle coordination. You become ataxic. लड़खड़ाते हुए जाता है आदमी. And you can immediately die. आज पिया हुआ है. So there may be vomiting. Hypoglycemia is very common factor in these patients. Patient will consume alcohol. They go into deep drowsiness. Added with the hypoglycemia. And patient सड़क के किनारे या नाली के किनारे पड़ा मिलता है. And they may die if there is cold weather because of coldness and associated hypoglycemia. Patient may go into irreversible brain damage and he may die there. It may cause ketoacidosis, respiratory depression, and there is cold clammy skin due to insufficient oxygen and he may go into coma. Management again, if patient is comatose, he should be intubated, admitted in ICU, give IV fluids and replace electrolytes, give dextrose solution and thiamine to treat alcoholic ketoacidosis. So with glucose, this thiamine must be given, B1. Always give the thiamine first. So without thiamine, if you give glucose to these patients, they may cause another damage, more damage. So correct hypothermia with gradual rewarming, no specific antidote available, perform hemodialysis if patient is still comatose and non-responsive. Aflatoxin, mechanism of action, symptoms same only, management again same, supportive only. Phenytoin, so drugs apart from ATT, anticonvulsants are very notorious in cause of allergy. So phenytoin induced hepatotoxicity may occur in some patient. Again same thing will be there, but autoimmunity is more. So fever, rash and lymphadenopathy. Sometimes jaundice and hepatosplenomegaly is there. So lymphadenopathy and hepatosplenomegaly is differentiating feature from other types of drug toxicity. So SGOT PT may be raised, ALP raised, and there may be primary hepatocellular degeneration. Thank you.